most urgent health challenges, promote preventive care, and foster collaborations across the public and private sectors. And by leveraging its trusted voice, NDTV continues to play a crucial role in shaping a blueprint for Health Vision 2047.
That's right, Sikta. NDTV's India Health Mission aligns with the Government of India's healthcare vision and aims to catalyze a national dialogue on transforming healthcare by 2047. The 5 pillars of health policy as envisioned by Prime Minister Narendra Modi revolve around preventive care, affordable and accessible treatment, early detection, technological innovation, and public-private partnerships. And these are the themes that we will delve deeper into as the day and our summit proceeds.
Right, Gargi, so it is time for us to begin our first panel, Preventive Health, Making Wellness a National Movement. Over to you, Gargi.
Thank you so much for that. If my panelists can please come on stage. As India marches toward the vision of Viksit Bharat by 2047, preventive health has emerged as a crucial pillar in transforming our healthcare landscape. With rising lifestyle diseases, growing health awareness, and an overburdened curative system, the need to shift focus from treatment to prevention has never been more urgent. And today with me on this panel to discuss this very important issue, we're joined by Dr. Chandrakant Laharia, expert health systems and public policy, nutritionist Ishi Khosla, Dr. Ashwini Setia, gastroenterologist, Ravi Bhatnagar, Director, Corporate Communications and Corporate Affairs, South Asia, MENARP, and Africa, RECIT. Thank you so much all for joining us, and a round of applause for our panel, please. Dr. Laharia, I'd like to start with you when we talk about, preventive health and creating awareness. If you could tell us a little bit about what this is exactly, and also how do we make it more popular in the underserved areas? Because I think in urban areas there is perhaps more awareness regarding this, but we need to take it to every corner of the country.
Thank you very much. And Gagiji, I would like to say special thanks to you because you said preventive health. Prevention is often a word which is very loosely used, and that's why it is insufficiently understood. So when we are talking about health or medicine, we should use the term preventive medicine or preventive health. Now, preventive health or prevention is something which prevent things which have not yet happened. And that's why preventive health is always underrated or underestimated. Curative or treatment is something which gives an immediate result or instant results. That's why treatment is always overrated or overestimated. Now, when we talk about holistic health and you were talking about 5 pillars, it's important that as a society or as a community, we start thinking of giving equal weightage or giving a due weightage to the prevention, promotion, curative treatment, because all 3 are equal pillars. So I always talk and discuss that prevention, promotion, and prompt treatment are 3 pillars which should be given a due weightage. In fact, if we follow prevention, we can avoid a lot of disease burden. They think if I fall sick, I'll get treatment. But I think that is a wrong approach. We are living in an era where diabetes, hypertension, cholesterol disorders are rising. If we do not follow preventive approach, it will result in increased burden on hospital. It will increase the cost of healthcare. A healthy nation cannot happen only by the hospitals. It requires preventive approach, and that's why we need to pay more attention. I'll come back to other aspects later.
All right, Dr. Laharia, and yes, I think that old adage, prevention is better than the cure, has never been more true than, today. Ishi Khosla, we're talking about preventive care, and there have been campaigns around fitness, health, mental health as well. Do you think these are enough? Are they, getting the right, are they, they're targeting the young people? Are they getting that message across?
There is no dearth of information today.
Yes.
I think we as a generation are far more equipped with information, knowledge about food, about diet, about nutrition, compared to our parents, our grandparents, and our great-grandparents. There's so much conversation around food. There is so much information on when you buy food. There is it was never before. We have calories, proteins, carbohydrates, everything listed out there. We have equipment when we're exercising. We have apps. We have everything today which was never there. But it's not adding up to good health. It is really, on the contrary, we are in a state of health crisis. And whether it's mental health, whether it's physical health, and the generations ahead. In fact, I'm going to quote from a Yale public health expert who has said, the coming generation of children is going to have a shorter lifespan compared to their parents.
Which is so shocking because we'd expect the opposite.
It has never happened in the evolutionary history of mankind. So something is clearly not fitting in. That its information is, is not lacking, but we are probably not making the right, striking the right chords. And I'm also going to quote from Dr. Mark Hyman, who's a functional medicine expert. And he says, and I think that will sum it up very beautifully, that today we are being fed by a food industry which is not paying attention to health, and being treated by a health industry which is not paying attention to food.
So there is more awareness now regarding, what is going into you and what ingredients are in our products, but it needs to be more widespread. I think
it needs to be legislated.
Policy as well. We do know trans fats. There has been a lot of policy change, regarding that. But
using the right grains, using millets, using rice, using...
And we have the millet mission as well, pushed by the Prime Minister. Dr. Ashwini Setia, that brings me to you. We're talking about lifestyle diseases, and of course, Dr. Laheria, you would know about the ticking time bomb that is diabetes. That's another lifestyle disease that is increasing in the country as people are consuming more and more processed food. But tell us a bit about, taking from there to create awareness. We have, fatty liver that has nothing to do with alcohol. It's more to do with the kind of, products that are being consumed, as Ishi Khosla said. And there's also, environmental factors. There's a lot of plastics in our food right now as well.
As far as the community part is concerned, there is a paradigm shift in what the community health was there, say, around 40, 50 years ago and what it is today. Earlier on, we used to focus on clean, potable water, etc., because it was waterborne disease and vector-borne disease, etc. Now, the non-communicable diseases, that is the lifestyle diseases, also spreading in the rural areas in our villages because of the industry, because of so many other things. The industry is sponsoring so many things and advertising it so vociferously that the convenience foods are available there for everybody to pick up. And these convenience foods are playing havoc with our health. The inflammatory bowel disease, that is ulcerative colitis and Crohn's disease, has paralleled the advent of fast food in this country. When I was doing my specialization about 45 years ago, at that time, we used to struggle to find one case of inflammatory bowel disease in the whole month or a whole year. Now, in every single month, we are having increased incidence of this. So that is because of the highly processed food. The high sucrose corn syrup is being used in cold drinks, and that is playing havoc with the health in terms of giving more sugar load. And you'll be surprised to know that fatty liver as such has got nothing much to do with the fat intake. It has got everything to do with the sugar intake. My own experience is that it is more than 80%, right? So everybody is having that fatty liver. And what they do not understand is that this is an incidental detection because there are hardly any symptoms which will bring the patient to the doctor. And therefore, you are getting the ultrasound done for some other reason and you pick that fatty liver up. Problem is that it is insidiously progressive disease because it causes inflammation in the liver and then it kind of proceeds on to become fibrosis and cirrhosis and further, in some cases, may also have hepatocellular carcinoma.
And people are landing up in hospital for this treatment, and you're saying this could be prevented had they taken care earlier, and we need to create that awareness regarding...
Not only that, so I would suggest that in case the message goes loud and clear that sugar must be avoided.
We're talking about messaging and getting that messaging right, and I'll come to you, Ishi. Tell us a bit about what corporates can do. What can we do at the school level? Reckitt has done so many, campaigns. They've been appreciated regarding, health and preventive health as well. So how can we get more corporates? What can we teach at the school level regarding this?
Thank you, Gargi, for having me here. And a beautiful partnership with NDTV from a decade almost now,
yes,
more than a decade.
One we're very proud of,
yeah,
yes.
Thank you. So, first thing first is like realizing like India is a big country. And if you see just Uttar Pradesh as a state having the population equal to the population of the UK. So no fun working with 100 kids, 200 kids, 1,000 kids. We also started with 2,500 kids when we started our program a decade back. And now it's almost 30 million kids to whom we reach out to through our program just in India. Nudges are very important, and the power of partnership brokerage is very important. You need to get the right kind of people to work with. It's a mix of public health experts, a lot of decorated doctors, Padam Shris, Padam Vibhushans, and others. Equally, the school teachers. And the best part, what has happened is like the change in the national curriculum framework and how the education policy is shaping up, especially in the schools. Now you have got the things what you can teach in the regional languages more. There is no compulsion to teach the messages in English. There's a big change, like CBSE has attempted now to talk about sugar in the schools. And like very proudly saying like we are one of the partners like who will be taking the messaging, even like, we have no relationship with the sugar industry or something directly. But we talk about hygiene at home, hygiene in neighborhood, personal hygiene, hygiene during illness, oral hygiene, and a lot of other things what we teach.
And it's so important to teach children because they take these messages home as well. But thank you so much all for joining us today to talk about this very important issue. And it's an issue that NDTV will take further along with this campaign, India Health Mission. Thank you all, and a round of applause for the panelists.
घुटना, कंधा या कमर, चाहे जैसा हो दर्द, डॉक्टर ऑर्थो आपको देता है दर्द से पूरी आजादी। ये कोई टेम्पररी पेन किलर नहीं, आयुर्वेदिक औषधि है।
एनडीटीवी से एक्सक्लूसिव बातचीत में जन स्वराज पार्टी के अध्यक्ष प्रशांत किशोर ने नीतीश कुमार पर निशाना साधते हुए कहा कि मुख्यमंत्री नहीं बनेंगे, इस बार जन स्वराज पार्टी से ही मुख्यमंत्री होगा। प्रशांत किशोर ने चिराग पासवान की सियासत की तारीफ करते हुए कहा कि उनकी राजनीति साफ सुथरी है, लेकिन उन्होंने कहा कि वो किसी से गठजोड़ नहीं करेंगे, जिसको साथ आना है वो हमारी पार्टी में अपना विलय करे। दिल्ली के रानी गार्डन में 21 साल के युवक की चाकू घोंपकर हत्या, बाइक की टक्कर के बाद हुआ झगड़ा, 3 आरोपी गिरफ्तार। दिल्ली के पहाड़गंज इलाके में पारिवारिक विवाद में बेटे ने की पिता की हत्या, आरोपी बेटा गिरफ्तार। लुधियाना में बुजुर्ग पर तलवार से हमला, हमले में बुजुर्ग की मौत, मामले की जांच में जुटी है पुलिस। मध्य प्रदेश के हरदा में बारिश से नदी नाले उफान पर, जान जोखिम में डालकर नदी पार करते हुए नजर आए लोग। बद्रीनाथ और केदारनाथ हाईवे भूस्खलन के कारण कई जगह बंद, जगह जगह फंसे यात्री। बागेश्वर में लगातार भारी बारिश जारी, सरयू नदी का जलस्तर बढ़ा, नदी किनारे बसे लोग परेशान। कुल्लू की सेंज घाटी में बादल फटने से तबाही, एनएचपीसी परियोजना क्षतिग्रस्त, ग्रामीणों ने की मुआवजे की मांग। लगातार मूसलाधार बारिश से रुद्रप्रयाग में प्रसिद्ध कोटेश्वर गुफा जलमग्न, जनजीवन अस्त व्यस्त। जैसलमेर में भारी बारिश के बाद हालात बदतर, प्रसिद्ध गणेश मंदिर में आया बारिश का पानी। अरुणाचल में सैपर कैंप में बादल फटने के बाद आया सैलाब, पावर स्टेशन को पहुंचा नुकसान। एक्ट्रेस शेफाली जरीवाला का 42 साल की उम्र में निधन, दिल का दौरा पड़ने का शक, पोस्टमार्टम रिपोर्ट का इंतजार। नवसारी में एक 3 साल का बच्चा कार के नीचे आ गया, ड्राइवर की सतर्कता के कारण सुरक्षित बचाया गया बच्चा। गुजरात के खेड़ा धोलका हाईवे पर टेम्पो से टकराया ट्रक, टक्कर के बाद टेम्पो और ट्रक में लगी आग। राजस्थान के दौसा में ट्रक से भिड़ी कार, 3 महिलाएं समेत 4 लोगों की मौत। आगरा लखनऊ एक्सप्रेसवे पर भीषण सड़क हादसा, फिरोजाबाद में ट्रक से टकराई स्लीपर बस, 3 की मौत, 2 घायल। मध्य प्रदेश के इंदौर देवास सेबी रोड पर घंटों से लगा हुआ है महाजाम, ट्रैफिक जाम के चलते 3 लोगों की मौत। जयपुर में गलत दिशा से आए डंपर ने बाइक सवार को मारी टक्कर, हादसे में बाइक सवार गंभीर रूप से घायल। राजस्थान के दौसा में भीषण सड़क हादसा, दौसा में ट्रक और कार के बीच जोरदार टक्कर, सड़क हादसे में 3 महिलाओं समेत 4 की मौत। सड़क पर दौड़ती बाइक पर टूटकर गिरा पेड़, चलती बाइक पर पेड़ गिरने की घटना सीसीटीवी में हुई कैद। इटावा में कथावाचक से बदसलूकी के मामले में 4 गिरफ्तार, अब तक कुल 23 लोगों की गिरफ्तारी। बेंगलुरु स्टेडियम भगदड़ मामले में केंद्र ने आईपीएस अधिकारियों के निलंबन आदेश को दी मंजूरी।
In a country as vast and diverse as India, true progress means making quality healthcare not